Hello, I am Shankalan, and today the topic about which I shall be discussing is common eating disorders in adolescence. It is a very important topic in pediatric psychiatry, so let us start. So as an introduction to eating disorders, it can be said that eating disorders are mental illnesses that manifest as eating extremely small amount of food or severely overeating and causing serious disturbance in person's diet and life. So here in this picture we can see on the left hand side this person is not eating at all, and on the right hand side this person is eating excessively. So both are eating disorders. What are the causes of eating disorders? They are broadly classified under three headings: psychodevelopmental factors, socio-cultural factors, and neurogenetic factors. Under psychodevelopmental factors we have bodily changes, life transitions, sexuality issues. Under socio-cultural factors we have peers, media, lifestyle, family values and abuse. Under neurogenetic factors we have brain chemistries, DNA structure and personality structures. All these things lead to eating disorders. Now, what are the types of eating disorders? Mainly there are 5 types: anorexia nervosa, bulimia nervosa, binge eating disorders, avoidant restriction food intake disorders, which is also known as AFRID, and not otherwise specified. In this presentation we shall be discussing anorexia nervosa and bulimia nervosa in much details. So let us start with anorexia nervosa. As an introduction, it can be said that it is an eating disorder characterized by extremely low body weight, body image distortion and an obsessive fear of gaining weight. So what are the characteristics? There will be disturbance of body image, excessive fear of weight gain despite of the fact that the person is very thin, and there will be restriction of energy intake resulting in significantly less weight than normal, which is according to ICD-11, BMI less than 18.5 kilograms per square meter. Here in this picture we can see this girl is having obsessive fear of gaining weight in spite of the fact that she is thin. Now one case scenario of anorexia nervosa. Here one normal girl looks at herself in the mirror and she sees a fat girl, so she tries to become normal according to her internal standards, which in reality is extremely thin. Now one thing is to be noted here, that the term anorexia nervosa is a misnomer, as there is no anorexia involved here. Now the image of the case scenario: this thin girl is looking at the mirror and she sees a fat girl. Now the epidemiology of the disease: the lifetime prevalence of the disease is 0.5 to 1%. Female is to male ratio is 10:1, that is, this disease is much prevalent among the females. It is mostly seen in adolescents. There is increased risk in first degree relatives. 1/3 of the cases will develop bulimia nervosa, and the long term mortality of the disease is 10 to 20%. Now what are the causes and risk factors of this disease? If there is high levels of cortisol, there is genetic predisposition, the perfectionists are more involved, the persons who are focused on pleasing others, there will be cultural pressure, overprotective parents, the professions like gymnastics, modeling, and the persons who lead a very stressful life are more predisposed to this anorexia nervosa. What are the clinical features? There will be medical signs and symptoms of starvation, amenorrhea, lanugo hairs, which are the neonatal hairs, hypothermia will develop, and dependent edema will develop. There will be bradycardia. Other associations include poor sexual development in adolescence and loss of libido in adulthood. The endocrine abnormalities includes there will be decreased value of FSH, LH and CRH, and there will be increased value of cortisol. We can note a peculiar behavior with the food, but the patient will not eat the food. The patient will be secretive in nature and he will deny any symptom. He will try to keep it as a secret. What are the subtypes of anorexia nervosa? 2 types: restrictive types, binge eating or purging type. Restrictive type can be 50%. The primary feature here is restriction of calorie intake. And binge eating type, here the patient eats a lot of food in a small amount of duration, and then he will try to take it out. Now what are the management protocol of this anorexia nervosa? It is very difficult case to manage, as the patient refuses to accept that they have the problem. Sometimes the symptoms reach to certain extent that hospitalization is also required. Now, what are the indications for hospitalization? If there are signs of dehydration, electrolyte imbalance, significant weight loss, and weight for height is less than 80% of the normal, then the person will require hospitalization. For the treatment protocol, behavioral therapy is given. Increase the calories gradually, as giving normal diet suddenly will lead to dilatation of stomach. Certain drugs like SSRIs, selective serotonin reuptake inhibitors like escitalopram, tricyclic antidepressants like amitriptyline, triptorheptadine, which is an antihistaminic, these things can be used. And in case of failure to gain weight, at least 2 hours of observation is required after eating, because the patient may go for purging. Now, what the prognosis of the disease: 40% of the cases will recover, 30% will continue with milder course, and 30% will lead to chronic case, where there is increased risk of death. And if the disease is persisting more than 3 years, there is poor prognosis. Now that is all about anorexia nervosa. Let's talk about bulimia nervosa. As an introduction, it can be said that bulimia is a Greek word which means ox hunger, and it can be considered as a failed attempt at anorexia nervosa. Now this disorder involves rapid consumption of large amount of food followed by compensatory behavior to prevent weight gain. What are the causes and risk factors? They are almost similar to that we have discussed in anorexia nervosa: poor body image, low self-esteem, dieting, appearance-oriented professions like gymnastics, modeling, major life changes, biological factors, all these things are involved. Now here's one case of bulimia nervosa. A thin girl is looking at a mirror and she is seeing a fat girl. Now what are the characteristics of bulimia nervosa? There will be episodes of binge eating. That is, a large amount of food will be ingested in a small amount of time, that is less than 2 hours, followed by inappropriate ways of stopping weight gain, which includes purging or hypergymnasia. Ways of purging will include self-induced vomiting, laxatives, diuretics, and use of emetics. Now, the types of bulimia nervosa: purging type and non-purging type. Purging type, as I have discussed earlier, will include use of laxatives, diuretics, enemas, and self-induced vomiting. And non-purging type will include excessive exercise. Here the person will suffer from hypergymnasia. So here in this image we can see on the left hand side is the purging type of bulimia nervosa, and on the right hand side is the non-purging type. So epidemiology of the disease: it is mostly seen in females in late adolescent age group. Here also the female is to male ratio is 10:1. Lifetime prevalence among the women is 1 to 3%, and 1/3 of the cases of anorexia nervosa will develop bulimia nervosa. And as I have said, it can be considered as a failed attempt at anorexia nervosa. The other associated features will include fear of gaining weight, purging. Weight is usually normal sexual functioning, and here the patient will be non-secretive. This is the main difference between anorexia nervosa and bulimia nervosa. In anorexia nervosa, the patient will be secretive. He will try to keep it as a secret. But here in bulimia nervosa, the patient will be non-secretive. Now, the complications due to purging. There will be dental caries due to continuous vomiting, which is identified by enamel erosions. And the person will try to put fingers in his mouth and try to vomit out. So there will be callus on the knuckles, which is known as Russell's sign. There will be parotitis, that is salivary gland inflammations, and due to continuous vomiting, all the acids are lost in vomiting. So there will be hypokalemia and hypochloremic alkalosis. Rarely esophageal or gastric tear during forceful vomiting are seen, which is also known as Mallory-Weiss tear. Now the treatment protocol. Here cognitive behavioral therapy is given. Here the thoughts, behaviors, emotions are all controlled. Antidepressants like SSRI, which includes fluoxetine, sertraline, these drugs are used. Mood stabilizers like topiramate are also used. Now the prognosis of the disease: 33% of the cases will remit every year. Another 33% will relapse into full criteria. Adolescent onset has got better prognosis than adult onset, and the death rate of bulimia nervosa is 1%. So that's all. Thank you for your patience hearing.